Good afternoon, everyone. I am Dr. Shilpa Hembrom, and I will be presenting on incidence of non-traumatic subconjunctival hemorrhage in the tertiary care center of Jharkhand. It is not.
Excuse me, can you help?
Let us get pause. Subconjunctival hemorrhage is a
Please start the timer. Please start the timer. Yes, please.
Subconjunctival hemorrhage is a common benign condition of the eye that has characteristic features such as the painless acute appearance of a sharply circumscribed redness of bleeding underneath the conjunctiva in the absence of discharge and inflammation in the contagious area. It is usually not accompanied with decrease in the visual acuity. The incidence of subconjunctival hemorrhage was reported as 2.9% in a study with 8,726 patients, and it increased with age, particularly over 50 years of age. It is thought that this significant increase depends on the increase of prevalence of systemic hypertension after the age of 50 years, also diabetes mellitus, hyperlipidemia, and the use of anticoagulation therapy becomes more frequent with aging. My aim of the study was to determine the incidence of non-traumatic subconjunctival hemorrhage in the tertiary care center of Jharkhand from December 2021 to December 2022. The method was a cohort study. Individuals with the first diagnosis of SCH were identified by corresponding international classification of disease 372.72 traumatic subconjunctival hemorrhage were excluded from the study. All demographic factors, comorbidities present, use of any medications were recorded and studies. Results were a total of 57 patients were identified in the period of 1 year. The incidence of non-traumatic SCH was higher in females than in males. Most common side affected was nasal. Most common comorbidities associated with non-traumatic SCH was hypertension. These are the graphs. From my study, I concluded that SCH can be a sign of serious systemic disorder. Our study was a prospective study, and so regular follow-up of patients was not possible. Traumatic SCH is very common, so it was excluded from the study. Saingolu et al. Reported 32% of cases as having non-traumatic SCH, but they considered traumatic cases in the total sample studies. After 60 years of age, the incidence of anti-SCH was increasing tendency, which may be more probably due to increase in the incidence of systemic disease after the age of 60 years, and also due to increased fragility of vessels. In our study, the highest incidence was found in the age group more than 60 years, which is similar to the study conducted by Yu et al. In our study, the incidence of non-traumatic SCH was more in females, which is similar to the study conducted by Yu et al. And Kaimbo. In a follow-up study of patients having SCH, Wang et al. Reported a significant risk of developing cerebrovascular episode. Anemia was also a systemic factor associated with SCH. In a study of anemia in the rural population of India, Alvarez et al. Has shown anemia to be prevalent in women and older adults, and this reason is in the favor of our study, where SCH is more common in females and in more than 60 years of age. In our study, nasal side was more affected. This could be because of the small area of nasal conjunctiva with crowded conjunctival vessels susceptible to SCH. However, our study result was in contrast to Saingolu et al., who reported temporal conjunctiva as a common site for occurrence of SCH. There was no preponderance of anti-SCH in a particular eye. However, right eye was more commonly affected, which could be just incidental finding. In conclusion, SCH should be evaluated thoroughly, as itself is not a serious condition, but it can be the sign of serious systemic illness. These are my references. Thank you.
How do you determine whether it is non-traumatic?
From the history of the patient.
Sometimes there may be a trivial history of trauma which the patients don't give, then those patients are included in this group.
Those patients who are not giving proper history, we have excluded them.
Suppose if a patient says that I noticed the red eye once I woke up in the morning, so maybe that patient injured himself with the finger or something at night. So was that included or excluded?
They were excluded.
Excluded. So what was the age distribution in of the population of your study? In case I missed that. What is the youngest?
Youngest, it was less than 20 years.
Less than 20 years.
Children 20 years and
Okay.